Now we talked about hypertension. Most women, most people will come and tell you, you ask them, Madam, do you have hypertension? They will say no. It is only when I have malaria and typhoid that my BP usually rise. That is a lie. That woman has been having hypertension. The only truth is that it is only when she has typhoid and malaria presumed is when she visits the hospital, and that is when she will now see that BP is high. I don't know if you understand. It doesn't mean that the BP was normal or why, because she has not been checking the blood pressure. The only time she will have time to go to the hospital is when she has a febrile ailment, and that is when they will now check the blood pressure and tell her that the blood pressure not required radiotherapy. And you will see she will just, and by the time you look at it, hypertension is a silent killer. It doesn't have a symptom, but it has only a sign. That's what I'm saying. Those symptoms you are looking for are not really directly related to blood pressure. In fact, these days, I want those electronic ones that you can keep in your house. Because when people come to the hospital to check their blood pressure, there is what we call white collar hypertension. Their BP might be normal at home. The moment they came to the hospital, that is strange. What their mind will start telling them, what will the doctor now say? Only God knows what will be. That fear of the doctor will even make the blood pressure to rise by 10 millimeter or 20 millimeter above normal. That one is called white collar hypertension. So the only way to cure that one is to allow the woman to check the blood pressure at the comfort of her room. Usually not immediately on waking up. There are some things people believe. They believe that the moment you just wake up, that the blood pressure should be the lowest, having rested. That time there is sympathetic overflow. And immediately on waking up, the blood pressure is a little bit higher than normal. You just have to wait for like 1 hour or 2 hours after waking up. You can now check your blood pressure at the comfort of your room when you are most relaxed. That will give us the right blood pressure. Is it clear? Now, but going to say that you know when your blood pressure is high because it used to give you headache here, or that one side is paining you, if that thing is caused by hypertension, know that it is caused by a complicated hypertension, not a hypertension. So by that time you are seeing that symptom, so much damage has already been done. So why waiting for damage to happen before you start taking your drugs? Is it clear? So people usually mistake sign to symptom. They are not the same thing. So when that person commits protein in the urine after delivery, we keep on doing that with the analysis. Maybe after 1 month, every 2 weeks, we keep on doing it. Once we did it for up to 3 weeks and the protein is still there, then that means there is already an injury to the kidney. You start immediately to calculate. So it's no longer a time of business as usual.